In late 2010, the FDA approved the new drug Pradaxa. Pradaxa acts as a blood thinner and is supposed to be prescribed to patients who suffer from the cardiac disorder atrial fibrillation. Atrial fibrillation is the most common form of abnormal heart rhythm. Patients who suffer from atrial fibrillation, or AFib as doctors call it, have inconsistent electrical activity in their heart causing the upper chambers to beat too frequently. As a result, the heart does not beat efficiently and blood can pool in the upper chambers of the heart. When blood pools, it can cause clots to form, which increase the patient's chance of suffering a stroke. The use of blood thinners to treat patients with AFib is not new. Almost everyone knows a relative or a friend who has taken Coumadin. Coumadin has been the go-to treatment for patients with atrial fibrillation for years. The problem with taking Coumadin is that patients must see their doctor frequently to have lab work done in order to monitor their blood clotting factors. The biggest risk for patients who take blood thinners is what happens when they have a bad accident or if they need emergency surgery. Since their blood does not clot normally, they run the risk of bleeding out unless they receive emergency medical attention. Fortunately, for those on Coumadin, doctors can quickly and effectively reverse the blood thinning effect by administering vitamin K or packed red blood cells. After that treatment, the patient can safely undergo surgery. The new drug, Pradaxa, is also a blood thinner. It works differently than Coumadin, but is supposed to accomplish the same result. The sales pitch for Pradaxa is the fact that patients don't have to go to their doctor regularly to have their blood levels checked. That certainly sounds a lot more convenient than Coumadin. But Pradaxa is significantly different than Coumadin in one very important aspect. There is no way to emergently reverse the blood thinning effects of Pradaxa. So if a patient who is on Pradaxa has a bad accident or needs emergency surgery, they are simply out of luck. Many will simply bleed to death, and there's nothing their doctor can do. The manufacturer of Pradaxa, Boehringer Ingelheim, has admitted that in the short time since the drug was first launched in late 2010, over 260 deaths have been caused by Pradaxa. A quick review of Pradaxa's website does not even mention the fact that the blood thinning effects of the drug cannot be reversed in an emergency. We first heard that Pradaxa could cause surgical patients to bleed to death from a physician who called us irate that a patient of his had bled to death during surgery. He was frustrated that there was nothing that he could do to prevent this tragedy. He was furious that the FDA had approved a drug that could kill patients when there were safer alternative drugs that were effective and had stood the test of time. To compound this danger, it appears that physicians are prescribing Pradaxa for general anticoagulation and not just for the treatment of atrial fibrillation. This is commonly referred to as off-label use. The Institute for Safe Medication Practices has reported that doctors are prescribing Pradaxa for off-label use twice as often as they are to reduce the risk of stroke in AFib patients. In addition to the risk of irreversible, uncontrolled bleeding, evidence is developing that Pradaxa is even more dangerous in patients who have impaired kidney function. Since Pradaxa is eliminated from the body through the kidneys, if a patient's kidneys are not working properly, abnormally high levels of Pradaxa can remain in the body. When this occurs, any bleed a patient suffers, even something as simple as an ulcer, can be life-threatening. Finally, Pradaxa has a very short shelf life and must be used within 60 days after it is dispensed. Some pharmacists are very concerned that patients will use the drug after its expiration date. Even doctors who conducted the most recent scientific studies on Pradaxa have been quoted recently as saying that they were completely unaware of the fact that the drugs expired so soon after being dispensed. Although it would not be helpful in this case, before you take any drug, ask your doctor about the risks and always read the warning labels very, very carefully. There are often safer alternatives to any drug.